28 would understand what we were doing. When you go to a public consultation, a big meeting with 300 people and people shouting, you're killing our people, you're making people travel farther, they will die on the bus, then it's hard for people to hear or understand. And I think we must get much better at having a proper communication. The call for action for primary care, which Claire talked about, the call for action that Adam talked about, is part of that process, but we need to do immensely more.
If you have ever persuaded anybody who was a protester, that you were right, if you've actually brought some people around, what have been the clenching arguments that you think have persuaded some people that actually, you know, saving every service in the Ealing Hospital wasn't?
It's normally just trying to find out what they're concerned about, because people are concerned about travel, that moving the hospital slightly further away, they'll die in the ambulance on the way, is the commonest thing we hear. There is absolutely no evidence to suggest that at all. We know what matters is getting an ambulance to the patient quickly. When you talk to people about that, then they can be reassured. But people are full of lots of anxiety. They also believe every hospital is like Hungry City, and you know, we go in there with whatever, and everybody will rush out and save them. And we know our hospitals are remarkably different from one another. As you can hear what people are concerned about and address them individually, then we stand a chance. But that's an individual.
I was interested in what you said about the focus group, which is closer to citizens' juries, which of course is the way that in Canada they brought about substantial change without all the palaver and placards.
We had 75 of those across North West London last year.
Yes. We're enormously grateful to you, and thank you so much for coming. We really appreciate it.